Do you think is it common to see people changing their mind about the gender identity while a child they think they are part of another gender, and when they grow up they change the opinion?
When you work with children, yes, this is common. For kids who are gender variant, whether or not they make the criteria for the diagnosis of either gender identity disorder in DSM-4 or gender dysphoria in DSM-5, it's quite common for them to lose that cross-gender identification and cross-gender behavior between the ages of 8 to 12 years old. Most of them do that. Most of them do not persist in that gender variance. In fact, the name that's been given to this is desistance. So most children will have a desistance of their cross-gender identification and behavior before they begin puberty. But as I mentioned before, by the time early signs of puberty are present, Tanner stage 2, we feel that then gender identity is fairly fixed. It's not totally fixed for everybody. There are certainly patients in my practice who have decided as older adults that they no longer feel so masculine or feminine, and they desire to go back to either the other gender that they were born and raised as, or they may decide to stop some things like hormones. So they begin a little bit of transition back because they feel more comfortable in between, not male or female, but somewhere transgender in between. But for children, it's very important to understand that about 85% of kids with gender variance will not be adults with transgenderism. About maybe anywhere from 1 to 20% will be, but that's a minority. So most children will not continue with their gender variance into adulthood.